Hi there, I'm the neuromuscular mechanic, and today we're going to be talking about ultrasound-guided chemodenervation of the gracilis. Like most of my videos, my one disclaimer, the muscles that you see today have normal echo texture. They're of my muscles, and individuals with spasticity just recognize that they often have increased echogenicity. So with the gracilis, you can start with the probe in short axis on the medial thigh about halfway down, and the gracilis is overlying the adductor magnus. Now what I'm going to show today on the videos is I'm going to show the relationship of the gracilis with the posterior hamstring muscles, as well as the relationship with the sartorius. The sartorius, like the gracilis, will insert onto the pes anserine, and often at the level of the mid-thigh, the sartorius will be more anterior with respect to the gracilis, and again we'll show this. So what I'm going to do with the first set of videos is show the relationship of the gracilis with respect to the hamstring muscles. So I have the ultrasound probe, posterior thigh, sort of middle posterior thigh, and there's my biceps femoris, most lateral muscle. Then what I'm going to do is I'm going to translate on that mid-posterior thigh a little bit more medially, and there's my semitendinosus muscle. And again, this is about midway down the thigh. What I'm going to do in the next clip is then I'm going to translate even more medial on the posterior mid-thigh to identify the most medial hamstring muscle, the semimembranosus. So here's my semimembranosus. And then in the next clip, what I'm going to do with the ultrasound probe is I'm going to translate even more medially such that now the probe is starting to come more anterior around the medial thigh. And what you're going to appreciate, and we'll pause right here, is there's my gracilis and the underlying adductor magnus. And so if you put the probe on the person halfway down the medial thigh, you would get this image, but I wanted to show you that relationship with the posterior hamstring muscles. And there again is the gracilis. So the next set of videos, I want to identify the relationship between the gracilis and the sartorius. So there again is my gracilis, there's my adductor magnus. I'm about halfway down the medial thigh. What I'm going to do in the next clip is I'm just going to bring the ultrasound probe a little bit more proximally. So here we go in a second. So I'm bringing it more proximally. And now I'm going to move the probe a little bit more anteriorly. And that muscle we see there is the sartorius. I know that the sartorius originates at the anterior superior iliac spine and then will go down distally and medially. And it has this important relationship with the femoral blood vessels that allows me to identify it. And so what I'm showing here, and we pause, is there's my sartorius, which is overlying the femoral vessels. And we know that that muscle will cross the femoral muscles as it tracks from lateral to medial in a distal direction. So again, I'm going to play this scan now, moving the probe more distally. There's the sartorius tracking over the femoral vessels. If I pause this clip, I'm about halfway down the inner thigh. My sartorius lies slightly anterior to my gracilis. And there again is the relationship between those two muscles, so that you have ways to distinguish between the two. And again, with the gracilis, there's no recommended dose per the monographs for Dysport or Botox. So keep that in mind. And to wrap up this video, I'm the neuromuscular mechanic, and I hope you found today's videos handy. Take care.